I'm Victoria. I'll be your student nurse today. Can you please confirm your name and date of birth for me?
Jordan Fong, May 10th, 2003.
Okay. Today we're going to be doing a neurological exam on you. I'm going to be having you do some tests, feeling your face, and looking in your eyes. Is that okay with you?
Yep.
Are you in any pain today?
No.
Do you have any history of concussions?
No.
Okay. Patient is sitting upright. She is alert, awake. She is conversive. She is tan in color. She looks her stated age, and she's well groomed. Okay. The first thing I'm going to do is have you confirm your name.
Jordan Fong.
Do you know where you are?
My house.
And do you know what day it is?
Friday.
Okay. And then patient's level of consciousness is intact because she was able to state time, place, and person and who she is. On the Glasgow Coma Scale, her score will be a 15 because her verbal response, motor response, and is a 15. Okay, now I'm going to I'm gonna have you stand up, and I'm going to walk with you. I'm gonna have you walk just there and back. Okay, perfect. And then while you're standing up, patient's gait is stable. Her stride is balanced. Her posture is upright, and her arm swing is opposite. Okay. Now I'm going to have you walk heel to toe, just there and back. Okay, and then I'm going to have you hop twice on one leg and then twice on the other. Okay, and you can sit back down. Patient's cerebellar function is intact because she was able to walk heel to toe and hop in place on one foot without swinging or trying to get balance. Now I'm going to do your deep tendon reflexes. I'm going to have you sit all the way back as you can, and then I'm going to put this in to test your reflex. Okay, patient's patellar reflex would be a 2 on the scale. And then I'm going to do the bottom of your foot. Okay. And then patient's Babinski reflex is negative because her feet plantar flex upwards instead of downwards. Okay. Now I'm going to test. I would have you do the Snellen test where you would stand 20 feet away from the letters. I would have you cover one eye, you'd read the low sign possible, cover other eye, read the low sign possible, and then uncover both eyes, read the low sign possible, all while keeping your glasses or contacts in. And then if you the expected finding is 20/20 vision. If you had 20, 30, or greater, I would refer you to an ophthalmologist. Now to test your near vision, I'm going to, this is cranial nerve 2. And then I'm going to have you read that 14 inches away, and then, go ahead.
The cat in the hat.
Okay. Patient's second cranial nerve is intact because she was able to read the print without adjusting it. Have you lost your taste or smell in the past? Okay. Patient's first cranial nerve is intact because she did not lose her taste or smell. And then, okay, I'm going to test your third, fourth, and sixth cranial nerve. First, I'm going to be testing for your pupil size. Okay, and then I'm gonna have you follow the pen, it's gonna touch your nose. Okay, and then I'm gonna have you look at my badge, and I'm gonna shine a light in your eye. Okay, and then I'm going to have you follow my pen. I'm going to do it in the cardinal directions. I'm going to have you follow with that tree in your head. Okay, patient's pupils are perla. They are equal, round, reactive to light, and accommodating. And then her extraocular eye movements were done in the test, and there was no staggering or wavering in the eyes when she was performing the test. So cranial nerve 3, 4, and 6 are intact because of those reasons. And then cranial nerve 5, I'm going to be feeling your temporal and masseter muscles, and I'm going to have you clench your teeth. Okay. And then I am going to be taking this Q-tip, and you can just tell me when you feel it on your face. Okay. Patient's 5th cranial nerve is intact because her temporal and masseter muscles were symmetrical in strength, and patient was able to feel the presence of the stimulus on the right and left side. Okay, so the 7th cranial nerve is the facial, so I'm going to have you raise your eyebrows, and then puff your cheeks, smile, frown, and close your eyes really tight. Okay. Patient's 7th cranial nerve is intact because she was able to perform those, and her muscle movements on each side were symmetrical. 8th cranial nerve, I'm going to stand behind you, and I'm going to have you cover one ear, and I'm going to whisper, and then have you cover the other ear, and then whisper.
Bedroom.
Right, and then cover the other one.
Lamp.
Okay. Patient's 8th cranial nerve was intact because she was able to listen to the whisper test without having to repeat the words. 9th and 10th cranial nerve, I'm going to stick this spoon on your tongue, have you say ah. Okay. Patient's 9th and 10th cranial nerve are intact because her uvula went up and in with phonation, soft palate moved, and the uvula was present as well as tonsils. Okay. 11th cranial nerve, I we'll do the 12th cranial nerve. I'm gonna have you say out your tongue. Okay, and then I'm gonna have you say light, tight, dynamite.
Light, tight, dynamite.
Patient's 12th cranial nerve was intact because her tongue was midline, and she was able to pronounce and say light, tight, dynamite definitively. Okay, the 11th cranial nerve is just give me a second.
So